Yeah, same.
Okay. Right, can you see the breast cancer awareness?
Yeah.
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 It's
Just put that on a slideshow. Okay, guys, so we should be live now. So, welcome. I'm Charlotte, and this is Healthwatch Berry's Breast Cancer Awareness Facebook Live. So I just wanted to go through a couple of guidelines today before we start our stream. So we want to be accepting. Everyone is welcome, regardless of race, ethnicity, national origin, religious affiliation, sexual orientation, sex, gender identity, or ability. We need to respect each other's boundaries, so we don't want to make advances or comments on appearance that might make someone feel uncomfortable, and we don't want to be rude by intentionally provoking, threatening, or insulting anybody. Not that that ever happens, guys, just to reassure you there. We don't want to flood the chat, so we want to keep the conversation going, but we don't want to repeatedly send the same comment because then other comments can get lost in that. We're not here to self-promote. It's not a sales pitch, so we want to stay focused on the topic of the stream. And we want to keep it clean, so no shocking, obscene, vulgar, or inflammatory language, please. So today I'm doing the Healthwatch Berry introduction, which is what we've just done, luckily. And then we have three lovely ladies that are going to come and talk to us around breast cancer awareness information. And then Steph will be taking over with our questions and answers as normal. So who are Healthwatch? So Healthwatch is your local health and social care champion. We make sure NHS leaders and other decision makers hear your voice and use your feedback to improve care. We listen to your experiences of using health and social care services and share them with people with the power to make the change happen. And we also provide you with information and advice. So we can support you by signposting to your local or online support groups, sharing information and advice about you or your family members' healthcare, and we listen to your experiences of using health and social care services within Berry. So I'm just going to leave this on for a second. This is our contact details. And I'm going to stop my video and pass over to our lovely ladies, if it lets me. There we go.
Thanks, Charlotte. I'm Alison Chapman. I'm Cancer Care Coordinator for Horizon Primary Care. So I work across 9 GP surgeries in Berry. I look after a lot of cancer patients from diagnosis to 12 months after diagnosis. And I do a lot of promotion awareness and encourage ladies to have the breast screening. So we're just going to share some information on that with you, if that's okay. So there's a few facts that I'd like to share with you to begin with. So October, as you may or may not know, is Breast Cancer Awareness Month. Breast cancer begins in the breast tissue itself. If caught early enough, it is more easily treatable. 1 in 7 women will develop breast cancer in their lifetime, unfortunately, and this is around 55,000 women and a lower number of men, but there's still 400 men each year that are diagnosed with breast cancer. 80% of breast cancers are in women over 50, and most men who get breast cancer are over 60. 10,000 women under 50 are diagnosed each year. I've actually got one of those ladies with us today to talk about her experience as well. And 3/4 of those women that are diagnosed each year are in the 40s, unfortunately. Generally, around 85% of women will survive breast cancer for 5 years or more. There's now a 10-year survival, which has increased from 40% to 78% since 1970, so that's great. So it's actually showing that so many more women are actually recovering and being treated for breast cancer and surviving longer, which is amazing. So the next slide is, I quite like this slide. It's obviously using lemons, but shown in like an egg tub, but I just think it really gets the point across as to what you need to be looking out for. So it's a change in the size or shape of one or both breasts, discharge from either of the nipples, which may or may not be streaked with blood, lump or swelling in either of the armpits, dimpling on the skin of the breast, a rash on or around the nipple, a change in appearance of your nipple, such as become sunken into the breast tissue itself. I'm now going to pass over onto my colleague, Naomi. I'll let her introduce herself to you. You're on mute,
Sorry.
Naomi.
Yeah, sorry. I'm chatting away to myself then. So just reducing your risk of breast cancer. I think that's your slide, Alison, isn't it? But just a couple of tips here about how to reduce your risk. So maintain a healthy weight, exercising regularly. This doesn't mean like going for a 10-mile run, because if you're anything like me, you won't be running that far anyway. So it just means just to get yourself like out of breath or get your body warm, and get your heartbeat racing really. Drinking low amounts of alcohol, breastfeeding, and treatment for women at higher risk. So moving on to my slide, I am Naomi from the breast cancer programme that covers Bolton, Bury and Rochdale areas. So yeah, as Alison said, she's got 9 GPs, I've got about 200. So yeah, it's a bit of a challenge, but yeah, I do love my job. So we have clinics in Bury, which is at Radcliffe Primary Care Centre. We've got 2 in Bolton, which is one at Bolton 1, one at Bolton Hospital, and then one in Rochdale at Bevan House. Sorry, my voice went then. And just moving on to the next slide. So just a bit of info about breast screening. Breast screening is an X-ray that detects any signs of breast cancer before any changes can be seen or felt. You'll be invited for your first breast screening appointment within 3 years of your 50th birthday. You might be eligible for breast screening before the age of 50 if you've got high risk of developing breast cancer, such as like the BRCA gene, and this is tested by your GP. Just lose where I'm at, sorry. If you're over 71, then you'll stop receiving automatic invitations for your breast screening, but you can still just get in contact with the breast screening office if you want to still have your breast screening after 71, and we'll still send you an appointment. If you are a trans man, woman or non-binary, then you might be invited automatically.
Have we lost volume on Naomi?
Yeah, I think we've lost Naomi. Yeah. She's been having some connection issues, hasn't she?
Okay.
Shall we talk through her slides if we've got any?
Yeah, I can pick up
we'll
on
obviously
that
answer
if
your
you want.
questions. Female at the GP surgery. So I think everyone looks like they're froze on my side. Are we all still here?
Oh, can we start this slide again? Sorry, Naomi, we lost you for a minute then.
Oh, did you? Sorry. Where did you get? Where did... So are we up to the invitation letter?
Yeah.
Yeah. All right. So breast screening invites anyone who's registered as a female with the GP surgery. You'll be invited for your first appointment between your 50th and your 53rd birthday. And you'll receive an invite through the post inviting you to come for breast screening. Your appointment letter generally includes your date, time and venue of your appointment. If you're unable to make the appointment that we've sent you via the post, just give us a call or email and let us know and rearrange a new appointment. If you have any additional needs, breast implants, a medical device such as a pacemaker, or wish to visit the clinic to see what happens before your appointment, because obviously it can be quite scary, please contact us and we can arrange any adaptations for you. So what happens at breast screening? Breast screening is always done by a female mammographer. There could be 1 or 2 mammographers at your appointment. If you have any concerns or queries about your appointment or what's going to happen, please feel free to ask them any questions. Your appointment generally takes around 20 minutes. This is from arriving at the clinic, having your mammogram and then leaving. During your appointment, you'll be asked to undress from the waist up, so we suggest that it's best to wear a separate top and bottoms. Some ladies say it's best to wear a camisole top like a vest top, and you can roll this down while you have your mammogram, and then you can obviously pull it back up afterwards. If you wear a headdress, these can be worn, but if it hangs down, you might be asked to remove it during your x-ray. This is just to ensure a clear x-ray can be taken. Some people find a mammogram to be uncomfortable, but it could possibly save your life. This is just a bit more information on what you should wear to breast screening. As I just mentioned, it's best to wear a two-piece outfit, such as like a top and bottoms. Try and avoid wearing dresses, because then you'll be stood there half naked or fully naked. And we just say don't wear talcum powder or spray deodorant on the day of your mammogram. This can affect your x-ray. It's all right to wear roll-on deodorant as well. Okay. So this is just a picture of what the mammogram machine looks like, and one of our lovely ladies who'll be doing the mammogram. The x-ray machine tilts, and you have the two images taken, obviously, of each breast. So one will obviously from the top and the bottom, and then it turns, and one will be taken from the side. If you have any implants, pacemaker, or any other medical devices, please contact the screening office. Next slide, please. What happens after your breast screening? So after your breast screening, your x-rays will be checked for any abnormalities. A copy of the results will be sent to you and your GP within 2 weeks of your appointment. Around 1 in 5 ladies will be asked back for assessment. This is done at Royal Bolton Hospital. Being called back for assessment doesn't mean that you have cancer. The first mammogram might have been unclear. Around 1 in 4 ladies who are called back may have cancer diagnosis, and then their treatment will begin. Next slide. And then just some information about how to contact the breast screening unit. So we've got our telephone number, which is open Monday to Friday 9 till 5, and our email address, which obviously you can email whenever you feel like it there. Also, we've got a Facebook page, so just follow us on BBR breast screening, and we've always got tips and tricks on there. And then if we just move on to Elena, she's here to tell you a story about her breast cancer story. Thank you.
Hi. So yeah, I'm Elena Szymanowski and I am a breast cancer survivor. I found a lump in March 22, and it was I've always checked, I'll be honest, in the shower or lying down, and never found anything. Unfortunately, this one day I was going on a hen do, so I was in bed a little longer than normal, so my daughter came to hug me. I literally leant over and found what was a large lump, really. Obviously took me back by surprise, and you obviously hope for the best. So immediately I did ring the doctors, which I was seen within the hour, which was absolutely amazing. Then my doctor was quite worried that she was bothered it was sinister, so she said, I'll send you now on, which they call a 2-week pathway. I was then seen within 10 days at Royal Bolton Hospital at the Sunflower Suite. Absolutely amazing. Couldn't make me feel any more at ease, obviously worrying about what was going to happen. So I had x-ray, mammogram, and a biopsy because of my age as well. I was 37 at diagnosis, so below 40 if they are a bit unsure, or in different cases a biopsy is taken. I left. Unfortunately, I did get told it was 90% benign, which obviously you go away a bit, oh, all right, might be okay. Unfortunately, this was a Monday. On the following Tuesday, I was told I would get a phone call with my biopsy results. On the Monday, I got a phone call to come in, which at that point, I only thought the worst, which you would. Unfortunately, when I did go, I was given bad news. Now, a lot of you might not realise there's different types of breast cancer. 3 are hormone related. Mine was not. So I had what they call triple negative breast cancer. So usually, or sometimes, should we say, you can also have the BRCA gene, if you've heard of that. So it's obviously with genetics and passing down in the family. Now, I have no family history, but I have 2 girls of my own. So obviously it is a worry from start to finish. So obviously your first question is, will I lose my hair? Which the answer was yes. I was saying, my dad then was like, don't be vain, it'll grow back. But obviously all these thoughts come into your mind that it's your identity. You feel like you're going to lose yourself and it's just going to take over your whole life. So I had the BRCA gene test done as well, which does take 6 to 8 weeks. So obviously at this point, my world had collapsed. So it was a case of now what was the next step. So they did inform me that I would be having chemo, and then I would go on to surgery and radiotherapy. So after this appointment, then I obviously then had tests done for the BRCA gene, which did take 6 to 8 weeks to be sent off and looked at. I then had numerous tests of my heart, my kidney function, and then I also had a port in my chest because I was going to receive chemo that way. We had agreed that I'd go to Christie's to have a port fitted. So a port is just where it's fitted under the skin. And you could always then get to that via a needle every time you go to, because I was having numerous chemos. They thought it was better than obviously going at my veins all the time because they can collapse. So yeah, the journey began really. So on the 1st of June then, so I was diagnosed on the 11th of April. On the 1st of June, after numerous tests, it all happened very quickly, and I will never thank the NHS enough for what they did for me and how they dealt with it. I always felt they were on top of things. I always felt cared for. I was always kept up to date. And then on the 1st of June, I started chemo. Very daunting, I'm not going to lie. I tried cold capping, which any of you that don't know, it's a cap that basically freezes your follicles. So hopefully in the long run, it'll save them. Unfortunately for me, although I did last on the first go, I lost my hair after 19 days. Or should I say I was losing my hair. So I decided to gain control back and shave it off. Which was an awful ordeal for my family, especially because I've got kids who are, well, at the time they were 10 and 3. So my eldest was struggling a little bit. I mean, obviously you hear the C word and your whole world falls apart. And all she ever said to me was, are you going to die? And it is tough, really is tough. But I'm one of them people, luckily, that I am very positive and you've got to go with it. And I think if you've not got the mindset, then you're going to struggle. But obviously the fear never goes away. It still hasn't today. But yeah, so you've just got to plod on really for you're in survival mode for your family more than yourself really, but you've just got to, it's another appointment down, it's another chemotherapy down. So my daughter, my eldest, was very much, just don't lie to me, be honest with me. If you're going to die, let me know, which is awful to have that conversation with your 10-year-old and then your 3-year-old not realising what's really happening. So obviously I had to be honest in the fact that I could lose my hair, I could be poorly, because they're going to see these changes. And it was me also losing my identity and how I would actually respond to that. So yeah, so I then shaved my hair off, which I did gain control back. I felt like I was right, I can do this. The worst has happened. My daughter in the end actually said, because she was scared of me losing my hair, my eldest, but in the end she was like, do you know what, you actually suit it, which obviously you've got to go with small wins. So yeah, so chemo then ended on the 30th of September, sorry. Within that, I did actually get the call on the BRCA gene that I didn't have it, which was amazing because there's all other worries that come with that, as in you then have a double mastectomy rather than what we discuss as a lumpectomy. Luckily, it hadn't spread into my lymph nodes. So, I mean, people laugh at me when I say I'm lucky, but I was lucky they didn't spread because my tumour was 3.5 centimetres. So it does feel quite large when it's a foreign object, if you will. So, yeah, so I finished. So luckily, yeah, the BRCA gene was great, which obviously made me feel better with my kids because we haven't got it in the family. So that obviously was a big relief. So I finished chemo then 30th of September. Then I went on to, I actually begged to go away on holiday because we'd cancelled everything with the kids over the summer. Everything we had planned obviously went out the window because I was poorly. So we went away, which was amazing. But unfortunately, when I come back, I'd got COVID. So unfortunately, with obviously then my health and my immune being so low, the best advice I was given was to wait 7 weeks then, which I think because I'd had an MRI after finishing my treatment. So I had three of one treatment and 9 of another. So I had 12 in total, but after 2 of them, I had an MRI to make sure it was working. And then if not, there was other options they could look at. And then I had an MRI at the end, which they advised me the cancer had gone, which was amazing. But I still think I had in my head, I still need this operation to make sure it's all gone and it wouldn't grow back. So coming off holiday, which was amazing, unfortunately getting COVID was not great. It delayed it 7 weeks. So for 7 weeks I was stressed, I'm not gonna lie, because I still felt like I needed this tissue to go where it was, because although the tumor had gone, I was having healthy tissue and a lymph node removed just to make sure it had actually gone. So anyway, long story short, I had surgery then on the 30th of December 22, which all went amazing. Again, amazing surgeons and everyone around me. I then went back on the 14th of January to get the absolute all clear. So when they had actually gone in to do the surgery, there was literally nothing to take away. It was just precautionary. So again, I can't thank everyone enough for what they've done for me, and I'm still here today. So that, and then following that, then I did radiotherapy at Oldham Hospital at the Christie there, and I had 19 rounds of that. So I had 15 radiotherapies and then what they call 4 boosters. So again, that all went really well. And again, it was just precautionary, making sure that no cells were left behind. So honestly, they went above and beyond to make sure that I survived this, and I have, and I'm here to live the tale. So it's a big and a long road, but you can do it. You can do it. And at the end of the day, if you find something, please don't second guess it. You're here once. And if you can catch something early, I know it's terrifying. And unfortunately, even my own friends now, with knowing me, and yes, I was 37, but you've still a long time to live. And if you can catch it earlier, I know it's scary. And they're still, a lot of my friends are still very much, I'm scared to find something. But if you can get it early, there's options, and there's people and the NHS there to help you. So never doubt that you can get help. Never think it's too late. So be sure to do that for sure. And then I had a mammogram then in August. Obviously a follow-up then after surgery and radio. So I finished radiotherapy at the end of March 31st. And then I had a mammogram then in August on both breasts, which I will then be having done yearly, which thankfully was all clear. So I'm getting back to normal. I'm back at work, and just loving every day, to be honest. So it's back to normal. So yeah, it's been a strange old year, should we say? And it is, when people say it is a year out of your life, but a year out of your life to save your life is amazing. And I do often compare it to maybe living a role in somebody else's life, which is a strange feeling, because you do look back thinking, actually, did that happen to me? So, and obviously my hair's growing back. So we're getting there, we're moving on, and hopefully we can leave the lump in the road, as I call it, in the past. So thank you for having me. And please keep checking, men and women. Thank you.
Oh, Lainey, thank you so much for sharing that story. That was really
No worries.
touching at one point when you're talking about your daughters, because these are things
No, yeah.
you don't always consider, do they? Those tough conversations that do break your heart. I mean,
Yeah.
wow. So thank you so much for sharing that. I'm going to pass over to Steph, who's got some questions for you all, whoever can answer.
Yeah.
All right, Steph.
You're on mute, Steph. Steph, you're on mute.
So hi, yeah, a lot of the questions I had down, you've already answered in the slides anyway. But I've got a few questions, especially to our Elaine. Elaine, you said you will always check your breasts, in the shower or lying down.
Yeah.
So how can women or men, check the breast area?
Yeah, I think what is also important to know about breast cancer, obviously learning what I've learned, even in your collarbone, you can actually find lumps which can be classed as breast cancer. So I often used to check under the armpit. So you have lymph nodes throughout your body. So there's obviously areas where they are. So I often used to check under my arms. So they do say lying down or in the shower is better, because I think the problem is as well, what people worry about, everybody's normal is different, and obviously time of the month and things like that. So even now I've had surgery, I've had to learn a different, because I have scar tissue, I've had to learn my new normal. So it's just a case of knowing your body and getting to know and doing their monthly checks. And I would say monthly, because sometimes you can do it too often and actually not notice changes. So I think it's a case of, I'd always check under your arms to your chest wall, under your breasts, over your breasts. And then I'd say if you can do it lying down more so, because you just get more of a better feel. And if you do that monthly, I say that was enough to notice any changes.
And did you get a lot of support from your family and friends? Because I know that you mentioned about your hair, which would be a big concern for any woman, because it's a big part of who we are. So I know you mentioned that your dad said don't be so vain about your hair. It's what you think of. Did you get any support from family and friends, particularly with your daughters, and helping them to understand what was happening?
Yeah, totally. I mean, I had the biggest support network, and I truly believe that's what made me get through it so well as well. I mean, obviously you have these different hats, and I brought in my daughters, where it was like, right, let's choose one for mummy and what I'm wearing, and you've got to make it fun, even though it's a really bad situation. And even to a degree, when I reshaved my hair once again, I let the girls get involved, because I was like, this is a journey that we're all going on. But the amount of support that I had, where people can you have the girls, they bought me turbans, they bought me wraps, they were so lovely about it. And then when it was growing back, they were like, oh, you're really suiting it. And it does make you feel good. And at the end of the day, it's difficult for everybody surrounding you, because they don't know what to say to you. They're going to say the wrong thing. But do you know what? Everyone in my journey was amazing. And I do truly believe it's what got me through. So again, talking about it is a massive thing for your recovery, I feel.
And then just one more question, I hope you don't mind me asking this. For somebody who's been diagnosed with cancer, and like yourself, you've got the all clearance, you're getting back to normal, your life. But there's all this sort of, this constant fear at the back of your mind. Well, is it going to come back? And how do you sort of deal with that?
Yeah, it's a good question, and I've had it quite a lot recently, especially going back to work and seeing more people. But do you know what? I'm a big believer in fate, and I do feel if you've got the support, the mindset of, do you know what? A lot of things in this scenario is out of your hands, and I've had to put my faith and the trust in the NHS, and they went above and beyond, in my opinion. And for all that, all you can do is going, do you know what? We had the help. We've got the help out there. So you can't live, although I have got the fear, don't get me wrong, you can't live every day in fear, because you'll never move on. And people do struggle. I'm not saying they don't. And I have had my struggles, but I am a very positive person, and I do believe your life's mapped out for you. I really do. And sometimes it can wake people up, and make them realize that the little things don't matter. So I think it's important to just be grateful and you've been given a second chance essentially, and you've just got to live every day to its absolute maximum, especially when you've got loved ones around you and you've got kids that, at the end of the day, like the amount of people that have said to me, you're such an inspiration, but I don't feel that. It's just, you just had to plod on. You had to get through it for your children, if anyone. And also teach them that you're resilient. Yeah, it's tough, but you're going to get through it. And the NHS and the support of your friends and family has been second to none. So you've also got to follow through in a sense that, do you know what? I will get on with my life and it will be okay. And do you know what it is? And I'm glad that I've gone back to work and I'm getting Elena back. I'm not wife or mum or the survivor. I'm me again. And not that I'll ever forget it or I want to, because it's part of me now, but you've just got to be grateful every day.
I suppose it's about maintaining a positive mindset as well.
Yeah.
I mean, that is every day of your journey to maintain a positive outlook. But I suppose as well for them women, you know, who've had the breast removed and,
Yeah.
you know, we've had to have breast reconstruction, you know, it takes a while to get used to a new normal. Like, your body's not the same as it used to be, so that takes some of getting used to.
Yeah, totally. And I think what you've also got to remember is, again, with other services, there's the support networks and counselling, and sometimes people do struggle to actually speak to the loved ones because they are too close. And that's it. I mean, I was lucky in a sense that I had a lumpectomy and everything was okay. I could have lost both breasts, which I had to get at one point my head round, in the sense of I could have had the BRCA gene, so I would have had to had them both removed. So it was a different mindset, and I had to come to terms with it a little bit, which I think the weirdest feeling is when I was then told I didn't have the BRCA gene. I was like, oh, because I'd set myself up for that. And again, not everybody is positive, and I get that. But I think in the long run, because there's that many options out there for support, we really are lucky in a sense that, I mean, down the road from me, I've got one of the cancer centres in Bury, and they were amazing. It's just, you've got to utilise these options to be able to know how to deal with it, and do speak. I think people who don't will then struggle in the long run. And I do feel that's why initially I was making people aware of, look, I was 37 and I got it. So don't ever think it, I mean, I don't want it to happen to you, but don't ever think it's not going to. And don't leave it if you find something. Please just get checked.
Yeah, and just one more question, because and you know, you mentioned about telling your children, and one was 11, 10, and the other was 3. So
yeah,
like young, you know, parents of young children, what advice would you give them, you know, who may be watching this, or who are like going through the cancer journey themselves, and we've got young children and we're wondering, you know, how do I sit down and tell them what's happening to me?
Yeah, well, initially, unfortunately, someone I knew from previous had actually dropped a book off about Mummy's Lump, which was an amazing way in with children to actually say, right, this is what Mummy's found. Mummy's going to go through this treatment and lose her hair. And it was a very, very good book to get through to children without actually scaring them. But then at the same time, all I will ever say is, do be honest. You can't, I know you want to protect them, but at the same time, unfortunately, it doesn't always have an happy ending. So if you can be as honest as you can with them and answer any questions they have, I think all you can do, because there's going to be visible changes. I think that's one thing that got me in the very beginning was, I am going to lose my hair. I could be sick. And my eldest is absolutely petrified of sick. I mean, obviously no one likes it, but she's got phobia with it. But from the off, I had to be honest. And in turn, my eldest, although she was like, be honest with me, and she did ask me questions, she also did stay away from me as well, because she was worried about me being poorly. So that took its toll, because I felt like she did distance herself. But everybody's going to deal with it differently. But I think all you can do is, as long as you're being honest and you can warn them. But if you do find a lump, please find a book called Mummy's Lump, because it's a very, very good insight on how to explain it to children without scaring them. It was very factual, and this is what's going to happen. And it's literally like you say, you found a lump. they go to the doctors, they're going to lose the hair. They then go and have a scan, and it's a really good book. But yeah, not a nice book, but obviously if it happens, it's definitely a good way to tell your children. But I wouldn't try and hold a lot back from them, is what I'll say. You want to protect them, but do you know what? You can, and it's also real life. So yeah.
Thank you, Elena. Thank you for your great.
You're welcome. Thank you for having me.
Well, thank you very much to all of you, Elena. Honestly, that really appreciate you being here and speaking about your story. That's a breath of fresh air, honestly.
Oh, thank you for having me.
So I'll say thank you to all of you. I hope you enjoy your Fridays. And if anybody needs to get in touch, please do reach out to us with the contact details that were provided throughout the live. And we can either signpost you or you can go directly. But yes, thank you very much for spending time with us on this Friday. We will see you all soon.
Thank you. See you
Lovely.
later.
Thank you.
Bye. Bye.
Bye.
Bye.